Hello, welcome back to Tech Smarter. My name is Abby Ritchie. I'm known as the tech guru and the host here. And this is the show where we talk about senior living and we speak with operators, innovators, and investors who are shaping the future of aging services. Today's episode is sponsored by Leading Age Arizona, and Tech Smarter is a production of the Smarter Service, which is a concierge tech service provider dedicated to empowering older adults with personalized one-on-one technology. So if you have any questions about that, go ahead and DM me. On today's episode, we're diving into the heart of the longevity revolution. We're going to explore AI and precision nutrition and how they're profoundly impacting global health. My guest is Sarah Hoit. She is an industry visionary and co-founder of the groundbreaking new company VitalityIP and chairman of the SIP Global Brain Health Initiative. We also have with us Allison Steele, the Senior Director of Operations and Giving with SIP's Global Brain Health Initiative. Welcome to Tech Smarter, Sarah and Allison. Thank you so much for joining me.
It is so fun to be here. And Abby, we have had such a long journey together, all the way back to, founding Connected Living in 2007, when everyone thought it was crazy that we were going to connect an aging population and have seniors have a voice. And you have been such a important and kind of revolutionary player in this whole mix. So this has been a fun, long journey, and we're excited to talk to you today.
Yay, I feel the same way about you two as well. And Allison, you've been on all of our emails, and I was like, you know what? Let's bring Allison on board too. She's in the discussion. So welcome to Tech Smarter, and for the first time in the interview here today.
Yeah, thank you for including me. I'm happy to be here.
Could you please introduce yourself, Allison, and give us a little bit of background of how you landed in the Aging Services Brain Health Initiative
Absolutely.
organization?
Of course. So I'm Allison Steele. I've had the pleasure of working with Sarah and her under her mentorship for quite a few years now. I started in senior living, working in a community. My mom is an LPN and has always, I used to go to senior living communities with her and do activities with residents. So I was very much always in the mix and developed a strong passion for seniors and healthy aging and very close with my grandmother. From my senior living community, I got introduced to Connected Living, fell in love with it and Sarah. And have now kind of transitioned into this space where we are, reaching more people, getting the youth involved in our organization and expanding our network to really drive home all of these organizations that are, that need to be interested in brain health and want to be interested in brain health. So it's been an exciting journey so far and lots to do.
Lots to do. You're absolutely right. And Sarah, I know a lot of people in the industry know you, but I want to ask you, before becoming a leader in AI and global health, your career has spanned from the White House to AmeriCorps to founding one of the most successful tech companies in the senior living space. Can you walk us through how you transitioned from public service and technology leadership into focusing so intensely on the needs and the technology adoption of older adults in aging services?
I can, Abby. I really view it as a somewhat of a straight line, even though it might not seem that way. My underpinning has been social impact and trying to find the problems that need to be solved. Sometimes you're not even sure why you're given the ones that you're given to solve. And I feel so incredibly fortunate. To me, the ability to bring together the public and the private world in every facet of my career to look at how we create change is really the only through line. When I started Connected Living and you and I first met, it was actually my grandmother was facing her own Alzheimer's battle. It seemed to me that we could really combat isolation and bring engagement and new life and brain health and community. Little did we know that the pandemic was going to hit and it was going to become an essential service. But also along the way, I think this is personal for all of us. You know, the journey of our health and our vitality is birth to death. And our beloved seniors, who we have all of us on this call spent so much time with, we know at that stage, so many are combating dementia or the effects of our lifestyle over many years. And we feel really empowered in this moment at the cross section of science and technology and health to not only bring a better quality of life for our aging population, but to really let people know how this affects them every single day. I think for anyone who knows me or has spent any time on looking at my journey is also informed by personal circumstance. And my children and I, while I was maybe 5 years into starting Connected Living and working with hundreds of thousands of seniors and their families on their journey, my husband was diagnosed with early onset Alzheimer's. And my children and I, while I was working in the industry beside you, trying to help so many others, we ended up losing him to a 10-year battle with what was frontal temporal dementia and Lewy body. And in the final year, he was also in a memory care in the middle of COVID. So to say that this is an issue that I feel with every fiber of my being is an understatement. And I am committed in all of my facets, both as a tech CEO and as a leader of a nonprofit, to really bring together the community in a moment of hope where we do have some opportunities and answers and chance to make people better, particularly also focused on our health and lifestyle. So my journey, while it might seem different, is connected along that through line.
I love that. Thank you so much for sharing that. And we have followed you and we have seen you persevere through this. And it is really remarkable what you have done. Thank you. And I also want to thank you, Sarah. And I don't know if a lot of people know this, but I think it was like in 2020, maybe even 2019, Connected Living was the first engagement platform that asked for customized content for their platform from me. And I started creating videos for you back then. And I just can't thank you enough for seeing how important that was for your residents and helpful for your staff. And it really helped shape the trajectory of my career. So thank you.
And your videos were fabulous and they loved them.
Thank you, thank you, thank you. Well, I want to move into talking about some of the precision, the promise of precision versus digital access. And Allison, you co-founded VitalityIP. It's a company that's dedicated to the intersection of AI and human vitality. And following your personal experience, possibly losing loved ones to dementia. So this work is all about tailoring health to the individual. Could you clearly define what you mean by precision nutrition?
Yes, absolutely. So in my terms, precision nutrition is all about tailoring dietary recommendations and interventions to each individual's unique biological, lifestyle, and genetic profile. So it's beyond just generic advice or following a diet. It is exactly as it sounds. It's giving specific nutrition guidance to those people. And I think technology has developed so much that it's a very clear line that it's a tool that we can use. And it's been really fun to see VitalityIP grow and develop to support those needs.
How is the user experience within something like that technology? How has it worked out?
So your user experience, you are inputting information such as allergies, preferences. So if you don't like carrots, or if you are allergic to, if you're gluten-free, all that information is put into your profile and used to create the solution that's best for you.
Got it. Thank you. Sarah, I know your mission is to advance human vitality. And in an age where every step in sleep cycle is tracked, it's easy to get lost in the numbers. Can you define human vitality for us, please?
Wow, that's a question. I think that that vitality is really about leading your best and healthiest life. And it's feeling alive, it's being energetic and balanced and purposeful. And if we know that about 70 to 80% of our outcomes are what we do every day, then our ability to have a lifestyle that is vital, that takes into consideration our food, our sleep, our exercise, our socialization, our purposefulness, our mindfulness, we will all lead better lives. We'll look better, feel better, be better. And it isn't, you think about people living longer, but it's really more than that. It is living better. And we are at a crossroads that really in the last 12 months, I wasn't planning on starting another company. And actually what happened, my co-founder is the former head of AI and retail for Amazon Web Services. His name is Michael Connor. He is one of the top AI specialists in the world. And I had him coming to some of these retail health initiative conferences I've been doing at Harvard to bring corporate leaders together who are the major tech companies, food companies, whose products and services can really impact the world, including giants and real leaders and partners in senior living like Sodexo, who serve nearly 100 million in 40 countries every day. So really bringing together these players. And we have a moment, Michael and I co-founded Vitality at the cross section right now of science and AI and nutrition, knowing that food is one of the big unsolved pieces of our vitality and our health. And the data sets of what it takes to really take a person, their economics, their access, their location, their conditions, their allergies, their whole family into consideration. And how do I actually put on the plate something that is going to impact both me and my family is something that actually every family wants to do. And the interesting thing is when you talk to some of these major retailers and others with whom we are working, or the large food service companies for whom, in senior living, precision nutrition is a life or death situation. We have our beloved seniors have multiple conditions, many medications, all kinds of different diets. And getting that equation right when you're the chef in one of those communities is really challenging. And so our opportunity right now to take the benefits of AI, taking these complex data sets that are actually quite hard for the human to do, and put them together in a way that now the nutritionists and the chefs can focus on the people versus sitting behind the scenes. Actually, the irony is AI allows you to humanize the experience because the humans can actually do the human part while the AI is getting some of the data sets right. And I think it's just a very exciting moment where we're using this data health platform that we've built with the science and nutrients and all the different pieces of getting a meal correct for a person's condition for the diet that they want. And then being able to either deliver that through a grocer into your shopping cart, complete with the menus and the ingredients and the amounts, or delivered via Instacart or DoorDash, or within senior living. As always, some of the leaders innovatively thinking about this are Sodexo is one who has worked with us and also helped co-create the Vibrant Minds diet, where we have looked at all of the diets that impact brain health and actually created a Vibrant Minds diet, a neuroprotective diet that took not only all the best of the existing science, but brought new science on top of it that hadn't yet been published in diets. And we'll actually be releasing a poster on that at the Leading Age conference. So people interested in brain healthy eating should come and see us. But, I think what is so exciting for me is I feel like everything I've worked on my whole career and the things I care about, the health, the food, the epigenetics, our beloved seniors, but really this whole lifespan of health, we have a chance to profoundly impact right now with this new product and service.
I love it. It's such a combination, like you said, of all the things that you've been passionately persevering and researching, and it seems to be really coming together in a very actionable way, which is phenomenal. And one thing I heard you say that I wanted to make mention of is, we may have been focused previously on longevity as opposed to healthy living, right? And at this point, we are now looking at how you can live longer, healthier, not just live longer, but live longer, healthier. Is that right?
That is absolutely right. And, you know, it's interesting is I think one of the things you think about your different superpowers in life. Well, one of mine is I don't look out in the world. I never did and see the competitor. I think that we solve these problems together.
Mhm.
And I really want to also tell anyone who's listening in the senior living world, not just the opportunity to think about precision nutrition and brain health, which we can absolutely help you with and actually save hundreds of hours of the chefs getting the right thing on the plate. But I want to encourage the audience to join us in our Innovation Olympics that we do through Social Impact Partners. We are in the middle of a season right now, and we have young people from all over the world. This is a play out of my national service playbook where we have teams of students thinking about the best ideas to impact brain health in the places we live, work, and age. And senior living is always very present. Katie Sloan and Leading Age have always been partners. Argentum has always been a partner. Sodexo has always been a partner. Many of our leading companies like the Benchmarks and others have participated. And so I encourage anyone who's listening who wants to get engaged to think about being a judge, a mentor, or joining in on our Innovation Olympics. Many of the projects that we're talking about and that we have started, like this new Vibrant Minds diet that we did in conjunction with Sodexo and all these scientists, came out of the two winning teams the first year with Food as Medicine plans. And even this whole VitalityIP and precision nutrition has come out of the collaborative work, both from that and then bringing the industry together through retail health. So I just feel like when we come together and we dare to share our best ideas and then figure out how all of us can lift them up, we can really create an enormous impact. And, you know, you had asked me about the technology and the wearables piece. As you know, with Connected Living, we were one of the first to bring wearables of every kind and robotics and into senior living. I've got them all. I've got the Apple Watch, I've got the Aura, I've got the Whoop, we've got all our things, and we're Uber users, and I do pay attention. Sleep is profoundly important. The big missing piece, though, is the food. And so one of the things we're going to be doing with Vitality is also connecting the wearables, because if I knew that my glucose was off the charts and it's connected to my patch and I can see how what I'm eating is actually impacting my health, it's those types of putting the pieces together that actually allow me to walk out the door and do the right thing. And we're seeing people, even the most informed. I mean, I cannot wait for the technology to be present and ready, which will be the turn of the year. We'll be lifting this up in a way that people could eat the neuroprotective diet, access it, shop it. And my partner, Michael, he doesn't mind my saying this. He was pre-diabetic and completely solved it after years by being able to actually find the ingredients, the nutrients, put the combinations together at the right time of day to not be in that situation. And this is all of us. We can, some of these changes it's not over long periods of time. We can make dramatic changes based on what we eat in a couple of weeks, sometimes even in a couple of days, in terms of our mental health, our physical health, and our long-term trajectory. So we're just, right now in this moment, people who are listening and want to be a part of it, they can reach out to us in a couple of different ways. They can reach out, Sarah at VitalityIP.ai. They can also reach out to us through Social Impact Partners and the Global Brain Health Initiative and get involved in either one or both are great ways to participate in this.
Excellent. Thank you so much. Wow, you dropped so many gems there. I'm gonna have to go back and watch it again. I am interested in seeing your poster at Leading Age. And Allison, I am interested in knowing how, just a regular user can integrate smart grocery lists or delivery services in order to maximize the perfect nutrient profile in delivery. Is it something that's going to become available?
Yeah, absolutely. And I think the core of what we're trying to do is shift from a fragmented, disease-focused health system to one that puts personalized wellness and preventative care at its center. And Sarah, I'll let you talk a little bit more about that.
Sure, how it's coming. So a couple of things. One, we are integrating with Instacart. You'll be able to put in your information, your tags, how big your family is, what kind of diet you're interested in. It will come up with your, with certain parameters for you, where you shop and the ability to access it. We are also working with very innovative grocers where we're going to have a VIP button, an agentic commerce button off of their apps, which the grocers and retailers really prefer. And so we have very innovative retailers who are going to be at the forefront of this. And then we're going to be able to lift it up under any retailer. So that if I were on one of our first fabulous innovative retailers is a great Midwestern grocer, Schnook Family Markets. They've just bought Festival Markets. They've got 150 in the Midwest. And you're going to be able to have like a VIP button that gives you that agentic experience, not only to put in what your family needs are, but if you're a regular shopper there, it has your history, it has your past, it can make recommendations based on what they know you like. And it's a way for the consumer to choose how far they do or don't want to go down a health path and how much they actually would like some support with accessing, planning, and feeding their family. On the other end, for our senior living friends, we have built a community model where taking that deep complexity of serving 150, 200 people with very different conditions, medications, diets, all the way to dysphagia. You have all sorts of things these chefs are dealing with. And it's very hard to get it right for everybody. And this takes enormous complexity. What we've been building with the chefs takes several days of work for them right now, and lots of dietitians to put this together. Can be done in less than an hour with the data sets with AI to kind of plan it out, and then let the dietitians and people go from there. So it's saving time. It's also saving food waste. The ability to actually get purchasing and procurement right in these large communities is a really big deal. And so we're really excited about helping communities get the right things on the plate, do it more elegantly, less food waste, and really in the way that can be best for the residents and for the staff. This whole issue of healthy living is a very big workplace issue too. And I'd be remiss, you and I know, Abby, that the concern about the senior living workforce, the enormous pressure that they've been put under always, and then in the pandemic, the shortage of staff for this amazing group of people, our ability to step out and serve them and make sure they're healthy and they're getting their steps and they're getting healthy food and have education and that they feel honored is really important for our communities as well. So I feel like this is just a gift all around, and a moment that we can really do something special and different and move the needle in bringing AI into our senior living places and have the chance to have precision nutrition.
Amazing. I'm so excited to hear about this. I want to circle back a little bit on something you said about the AI and the precision nutrition. I want to make sure, is there a way to make it equitable and effective for all populations? Is it trained on diverse biological and lifestyle data as well?
Abby, this is a real focus, as everyone in the health space knows that access to healthy food and food deserts and poverty and what's happening right now with SNAP benefits and the fear out there of how do I put anything on my family's plate, let alone the right thing. I think that we are at a revolutionary moment here too. We are encouraging and working with the last meeting that I held at Harvard in our retail health initiative was about forming pragmatic trials and moving the science forward as corporate players, because every single one of our consumers is walking in with a health condition. Add poverty to that, add benefits to that. Now you've got a real situation. And so we are working to put together the payers, the insurance companies, the fintech cards like Soda with your SNAP benefits, and the retailers. And they're all really excited because let's just take a subset population with diabetes. Well, diabetes we know is a precursor to dementia. Diabetes diagnosed, very costly prescriptions. We absolutely can impact the diabetes with different nutrition. So more money goes into your card or your basket or your health plan if you're buying the fresh fruits and vegetables, moving yourself onto a different path. And so we're working really hard to put those complex pieces together. It's we know the answer to our question. We're going to save hundreds of millions of dollars and make many, many people better and this is actually a topic with all the brokenness in the world right now, that I think people agree, food is medicine.
Yep.
What I eat and what I put on my body and how I live completely impacts my wellness and my vitality. And so you've just hit on a point that is so essential and crucial for me. We were just speaking at the UN, Michael, my partner, Sodexo, on the combination of innovative technology, AI, brain health, and our new diet. And we spoke 2 days at the United Nations meetings. And what was so stunning is the world is literally grabbing for solutions. We can talk about the problem all we want, and that often happens at the conferences, but how do we step out and do something about it? And I think this is really, really a hopeful moment where those data sets, we actually, the North Carolina delegation, Josh Stein, who's a governor of North Carolina, and his team, they got up at the UN and talked about, they had an insurance company and they had their head of health, and they were putting these interventions together, right? So that was a government group doing it. So I think we have to be creative. We have to be out of the box. We have to partner, and it's good business, and not only good health, it is good business, will not only make us money, but save us hundreds of millions of dollars in health costs by actually allowing people to have access to better food, healthier food, and vibrancy. So it's complex, but the world is listening, and there are many, many partners out there on the front wave of it.
Yeah.
And so I would say, again, if anyone is interested in adopting AI, precision nutrition, and senior living, thinking about, runs a retail and is looking to do personalized agentic shopping that is healthy for your customer. The other thing that we're going to do, Abby, we did it at Connected Living, right, where we had the ambassadors on the ground. It's high tech, high touch. Mm-hmm. I was just on with a very innovative, another Midwestern grocer, thinking about how you can have a digital nutritionist helping you put some of these together. And here's the products and here's the ones to avoid. But then you could also opt into a personal nutritionist. We're actually now going to be saving time. All these major grocers have nutritionists. Sodexo has 5,000 nutritionists. They're the largest employer in the world. And if they're freed up from these spreadsheets that are really difficult and challenging to be able to do the frontline intervention, I might be able to get my mom or my daughter a chance to talk to a nutritionist and add that human element combined with the agentic personalized shopping. So it's really, it's exciting, and it's happening now. And the only other thing I will say for anyone listening, the speed with which this is happening, in 6 months, not a year, in 6 months, the world will be different. That is how fast it's going.
I love that. And I know that wasn't always the case. And so I'm really excited and energized and motivated by that. And I wanted to ask Allison about how people can get engaged with this mission.
Yeah, so there's multiple ways where we can get engaged. I'll talk about social impact partners, and I'll let Sarah talk about VitalityIP. But as you guys were talking about, how this becomes equitable, one of the things that is, as we gain more trust in AI, we have collaborative policy and funding frameworks. It's huge. And one of the things that we've been fortunate to host for 2 years, and 2026 will be our third year hosting our annual Global Brain Health and Longevity Strategy meeting in DC. This past January, we had it in the beautiful Kennedy Caucus Room, and we had leaders from every sector you could think of, and experts. We had our students that were on the winning teams of the Innovation Olympics from Canada, from Arizona. We had the American Heart Association, Kroger, all of and our senior living partners. Katie Sloan was there, and we were even more fortunate to have 6 senators show up, be there in the midst of all of the craziness of their lives, and show that they were committed to this mission as well. So we had Senator Kirsten Gillibrand, who is on the Aging Committee, Senator for New York. And then we had Senator Cory Booker, who is big in food is medicine, Senator from New Jersey. He's wonderful. And then we had multiple other senators from both sides of the aisle who really showed up and showed us that they could be part of, that they were working towards a solution with us. And so we will be releasing our date for that soon. So we'd love for everyone to RSVP and be part of that. We'll also have a fundraising dinner that we'd love for organizations to be a part of. And then, as Sarah mentioned before, our Innovation Olympics is a great opportunity to tap into the young minds that are, making our future possible, and are committed to solving Alzheimer's and chronic conditions. The ways that people can get involved with the Olympics, you receive so many insights. You get potentially access to top talent. These are post-grad, undergrad, kids that are going to be looking for adults that are going to be looking for jobs soon. Yeah. And so not only do you get to share your expertise and insights and your experience, but you also get to take something away from it as well. And as a nonprofit, donations help make those programs possible. So that's one way. Those are a couple ways to get involved with social impact partners. And Sarah, I'll pass it off to you to talk about Vitality.
No, I think we, this is Allison and I are very easy to find on LinkedIn. We'll respond to you if you reach out. From really diving into the personalization and precision nutrition through Vitality and an interest there. I'm Sarah at VitalityIP.ai. But all of these things connect, and we hope very much to see many people who are on this podcast this coming Monday, Leading Age. And so glad that we've called out several times the importance that organization has had, the commitment that Katie Sloan and her team has given to all of these initiatives, and how critically important the senior living community has been in taking a leadership role in all of these topics. We know that if you are in senior living, you are likely dealing with a condition, and in many cases you are dealing with some form of dementia, and we have a very long way to go, and yet we have a very hopeful moment of new things happening. And so people's ability to join this path and realize that neuroplasticity is real. We can impact our brains and our health every day, no matter how old we are. One of the messages I do also try to get out and said at the UN and the science sessions is our first 1,000 days in utero. A mother's ability to get the right food completely impacts the formation of the brain, our organs, our body for our life. Breastfeeding is actually quite important. There's all the omega-3s, back to some of these vitamins. So this is a lifelong journey, and it's an every age issue. And I think it's one that hopefully, as we move forward here, and you'll see the next 12 months, 6 months, everything will be different. 12 months, agentic and personalization in your food and precision nutrition will be here. It's only a question of who's the front wave, but people will be impacted and will be taking advantage of it in many different settings, their homes, their communities, and for their children and their families.
Yeah, and one of our really great partners at McKinsey Health Institute, Kana Inamoto, she had a really nice saying that has always stuck with me since she said it was, it's not just about adding years to your life, it's about adding life to your years, which I think is what this is all about.
100%. Wow. You have shared so much with us, and I am also really excited to meet with you next week at Leading Age on Monday in Boston, and to connect with you that way. So for anyone who's watching, Sarah will be there on Monday, and they'll be sharing their poster there. And to all of our listeners, I just want to thank you for spending your valuable time with us today. I also want to thank Sarah and Allison for being so generous with their time and their insights. And for anyone watching and participating in the chat, thank you, thank you, thank you. We value that tremendously. So gals, thank you. See you next week. And we'll be right back here 1 week from now. Thank you.
Fantastic. Thank you, Abby, for your leadership and your voice and all that you do to lift all of this up. We are really grateful.
Absolutely.
Thank you.
Bye.
Bye.